Hello classmates, my name is DeAndre McDonald and this is my video presentation on physician-assisted suicide. What this issue is the patient's ability to have their provider fill out a prescription that will hasten the process of dying in favor of them not suffering until their inevitable death. Who this affects are people suffering from various forms of cancers and terminal illnesses which they will not recover from. Once a disease is deemed terminal, that means all treatment plans are exhausted and the patient will in fact die. It's just a matter of when. The reason I feel so strongly about this is because I am a hospital corpsman at the Naval Medical Center and I work in the oncology clinic. I've seen firsthand how people suffer throughout their last stages of life while they're waiting on their death that they cannot do anything about. The most that we can do is offer hospice care, and what hospice care is, it is limited medical attention that is focused on treating the symptoms since we can no longer address the problem of what is causing all of these symptoms. These include minimal pain medication, fluids, and quality of life care while we are waiting on the patient to inevitably die. Dr. Jack Kevorkian, a physician who was arrested in the early 1990s for videotaping himself administering a lethal dose of medication to a man suffering from Lou Gehrig's disease, was an early pioneer of physician-assisted suicide, and he advocated for a patient's right to die. The reason he felt so strongly about this is because he had numerous amounts of patients, which he admitted was over 100, who would go up to him and ask him to administer lethal doses of medication because they did not want to suffer from whatever terminal illness they had. A couple years ago, there was a woman named Brittany Maynard who was diagnosed with stage 4 brain cancer 2 years after she was married, and she did not want to suffer through what was explained to her to be the process of her dying from this brain cancer. So she moved and started a foundation called the Brittany Maynard Foundation. And what this foundation wants is to bring awareness to people who are suffering from these various types of cancers, which is increasing. And she pioneered for her own ability to take her own life via medication prescribed by a doctor. Now, as of June of this year, there are only 7 states in the country that offer a patient's right to be euthanized by their providers, essentially. And it is illegal stipulations that are placed on these 7 states, which include you have to be in the last 6 months of your life, you have to find a physician willing to fill out the prescription. Once given the prescription, you are not obligated to take it, but a doctor is not obligated to prescribe you the medication. So even if you were in one of these 7 states, you could ask a physician to fill out their medication form, and they could deny it because it does ethically go against the Hippocratic oath that a provider has to swear, which includes that they will not willingly harm a patient. However, to be a patient advocate and to feel for these people and see what they go through in these last stages of life, it is truly heartbreaking. The research that I've done has found that just the option of knowing that you don't have to be caught in a existential limbo between life and death brings comfort to these people, and it is something that should be thought about to be legal in all 50 states, regardless of residency, regardless of the other legal stipulations, and whether or not a court orders that you should have the right to have your life ended without suffering. These symptoms that these patients go through at the end of their life is something that none of us are comfortable seeing them go through. It is not something that their families are comfortable seeing them go through. And again, Dr. Jack Kevorkian agreed, but he was ostracized and even arrested for 8 years for his beliefs and for his willingness to offer these medications. My question to the class is, how do you feel about the subject? Suicide is a very touchy subject, but in a medical sense, when it will stop suffering, does that or does that not change your opinion on whether or not someone should legally be able to do so? Also, a second question is, if it were you, would you rather let nature take its course and endure the suffering, or would you allow a physician to prescribe you a medication to end your own life? Thank you guys, and you have a good day. I look forward to writing this paper.